this means to our family. Y'all don't know. I didn't know how my sister affected everybody.
Hey, I'm Dave Coulter, Oakland County Executive, and I'm here with our Health Director, Dr. Calandra Green, to celebrate National Public Health Week and to acknowledge our great public health team here in Oakland County. During the first full week of April each year, National Public Health Week is a time to recognize the contributions of public health departments and highlight issues that are important to improving our health. That's one of our top priorities.
She had 4 degrees and a PhD. He drove trucks for a waste management company. Dr. Calandra Green was Oakland County's first Black health officer, award-winning, respected by thousands.
And the winner is Calandra Green from Oakland County Health Division.
In 2021, Dr. Green was given the Nightingale Award for her COVID-19 efforts, including overseeing the distribution of 1,000 vaccines in a matter of 4 days.
But today, nurses, we stand strong. We stand united. We stand undefeated in our pursuance of health and well-being.
The night before she died, she was once again at the Nightingale Award ceremony, this time supporting her co-workers. The next day, when she didn't show up to work, something was off. They called her family, who went to her house and saw something wasn't right and called 911. According to the sheriff's office, deputies entered the home and found Dr. Green's body on the floor with her back against the couch and her husband nearby. The medical examiner ruled the husband's death as a suicide, Dr. Green as a homicide. The motive unknown at this time.
This is a tragedy all around, and that there are 2 families that have been affected. And at the end of the day, we just want healing for both families.
The county executive plans to ask the governor if she can order the lowering of flags to half staff in honor of Dr. Green.
Yet on May 11th, 2023, this remarkable woman's life ended tragically in her own home, along with her husband, Charles. The medical examiner would rule her death a homicide, while Charles also lost his life that day. This case has sparked passionate conversations about relationship red flags and whether warning signs could have prevented this tragedy. The couple married in September 2020, with sources suggesting they had a relatively brief courtship before the wedding. Wedding photos and videos showed Dr. Green celebrating what appeared to be one of the happiest days of her life. The exact details of what led to the events of May 11th remain unclear, as authorities have not released specific information about any marital issues. Could this tragedy have been prevented? And what can we learn about relationship safety from this devastating case? Before we get too deep, please remember to like, comment, and subscribe if you find value in these discussions. Dr. Calandra Green was born on August 4, 1972. Calandra grew up in Pontiac, Michigan. She graduated from Pontiac Northern High School and started her journey at Oakland Community College, where she earned an associate degree in nursing. Dr. Green never stopped learning. Over the years, she earned 4 different degrees, starting with nursing, then a bachelor's in health services, an MBA, a lean leadership certificate, and finally, her PhD in organizational leadership at age 48. Her career path shows you exactly who Dr. Green was. From 1993 to 2007, she worked at North Oakland Medical Center in Pontiac, rising from nurse to manager of obstetrics and the neonatal intensive care unit. From 2007 to 2018, she moved to McLaren Healthcare in the private sector, advancing from manager of patient care services to vice president of patient care services and chief nursing officer.
Hey, I'm Dave Coulter, Oakland County Executive, and I'm here with our Health Director, Dr. Calandra Green, to celebrate National Public Health Week and to acknowledge our great public health team here in Oakland County. During the first full week of April each year, National Public Health Week is a time to recognize the contributions of public health departments and highlight issues that are important to improving our health. That's one of our top priorities in Oakland County, ensuring that our residents can get and remain healthy through access to affordable, quality health care. Let's talk a little bit about this past year, Calandra, and the achievements of our team here in Oakland County.
Absolutely. There is no doubt that COVID-19 has transformed our lives in the last few years. It brought continual change, challenges, and new successes. As we look at the past year, we see how we responded to emerging public health issues, but also recovered and re-engaged in the wake of the pandemic. Just a few things to highlight from the past year. Our response to the emerging Mpox virus outbreak through case investigation, giving vaccines, community outreach, and providing education. We successfully launched the Harm Reduction Clinic at 148 North Saginaw Street in downtown Pontiac to prevent opioid overdoses, Hep C, HIV, and reduce hospital-associated infections. We continue to provide COVID-19 and flu vaccines in the clinics in our community. We helped address food insecurity through the county's food assistance programs and grants, our WIC supplemental program, senior market days, and providing prescriptions for food vouchers and for those in need.
Well, Calandra, if these past few years have taught us anything, it's how important our public health system is, not only during a crisis, but in providing accessible health care to residents. I want to give a shout out to our public health staff here at the Health Division for all your hard work and dedication. We also want to say thank you to all our community partners. Without your collaboration, none of this and more would be possible.
Yes, we have an amazing team here at the Health Division, and we couldn't do any of this work without them. If you are interested in finding out what our team does day to day, make sure you follow us at Public Health OC on Facebook and Twitter. We will be highlighting our staff in action on our social media channels all week, so you can learn more about the different services that we offer here at the Health Division.
So, Calandra, what are some of the ways that people can check in on their own health during National Public Health Week?
We are hosting a free virtual baby safety fair this week. Caregivers are welcome to attend on Tuesday, April 4th from 10 to 11:30. The safety fair will include 6 short presentations about safety topics, including infant safe sleep, child passenger safety, postpartum depression and coping, and WIC program, and much more. Stay up to date with important health information and events by subscribing to Healthy Oakland newsletter. This is our public health newsletter that goes out once a month. Text Healthy Oakland at 468-311 to subscribe.
In March 2020, as the pandemic began, Dr. Green transitioned from private health care to public service. She joined Oakland County as a public health nurse and became the Health Division's Quality and Process Improvement Supervisor. Her job was massive. She served as the COVID-19 school nurse liaison, where she hired, trained, and deployed 68 nurses to 28 public school districts and 125 private or charter schools. This was her accepting one of nursing's most prestigious honors.
One of their own, Dr. Calandra Green, had her life end in tragedy. It's not the type of statement Oakland County Executive Dave Coulter thought he would ever have to make.
Dr. Calandra Green, who is our health officer here in Oakland County, is deceased. It appears to have been a murder-suicide.
A tragedy allegedly committed by someone she took a vow to love and cherish.
You know, she was recently married within the last couple of years. She was still practically a newlywed. And from what we knew of Calandra, she was still a happy bride.
A devoted wife, mother, and stepmother, Calandra was also devoted to her work, making history as the first person of color to hold her current position.
One of the things her staff always told me is that they don't think she ever takes a day off.
So they knew something was wrong when Calandra did not show up for work on Thursday. That's when Calandra's mom was notified. She went over to her daughter's Pontiac home and knew something was wrong. The sheriff's department was called in and found Calandra and her husband were fatally shot. The medical examiner calling Calandra's death a homicide and her husband Charles Green's death a suicide.
Definitely shocking because they're right diagonal from us in our backyards.
The fact that she was murdered, frankly, leaves me really angry, on top of the grief and the sadness and the shock that I feel.
2 clinics were closed Friday so staff could grieve. Coulter says no one saw this coming.
There was no indication that there was any issues at home.
Now the county is reflecting on all Calandra accomplished.
That during the pandemic, she really took the lead on standing up all of our COVID testing and vaccine sites.
She also organized mental health services for the Oxford community after the deadly school shooting and was passionate to making sure all of Oakland County got access to public health services. Her colleagues knew she had so much more to accomplish.
The possibilities based on her abilities were endless.
Mr. David Coulter, his entire executive team, and Leanne Stafford, Director of Health and Human Services, for providing the support and foundation in developing the COVID School Nurse Initiative. A special thanks to School Nurse Julie Knopp for this nomination, support staff, and all 16 nurses who pooled their unlimited talents of critical thinking, client advocacy, and servant leadership that gave our initiative life. Thank you to my family for your continued support and encouragement. COVID aimed to conquer, destroy, separate, and limit our families, our coworkers, our business relationships. But today, nurses, we stand strong. We stand united. We stand undefeated in our pursuance of health and well-being. I celebrate this honor with each and every one of you. The woman presenting the award said this about Dr. Green.
The winner is Calandra Green from Oakland County Health Division.
In 2021, Dr. Green was given the Nightingale Award for her COVID-19 efforts, including overseeing the distribution of 1,000 vaccines in a matter of 4 days.
But today, nurses, we stand strong, we stand united, we stand undefeated in our pursuance of health and well-being.
The night before she died, she was once again at the Nightingale Award ceremony, this time supporting her coworkers. The next day, when she didn't show up to work, something was off. They called her family, who went to her house and saw something wasn't right and called 911. According to the sheriff's office, deputies entered the home and found Dr. Green's body on the floor with her back against the couch and her husband nearby. The medical examiner ruled the husband's death as a suicide, Dr. Green as a homicide. The motive unknown at this time.
This is a tragedy all around, and that there are two families that have been affected. And at the end of the day, we just want healing for both families.
The county executive plans to ask the governor if she can order the lowering of flags to half staff in honor of Dr. Green. Reporting in Pontiac, Andres Gutierrez, CBS News, Detroit.
Calandra is a community lifeline. She manages to get to 68 nurses remotely and is available 24/7 for solving problems. Partnering with community leaders in Pontiac, Calandra took on the challenge to get 1,000 vaccines in arms in the Pontiac community in just 4 days. She has been driven to educate and vaccinate her community and to save lives. In May 2021, she was promoted to Administrator of Public Health, developing and managing comprehensive county-wide programs. She organized mental health responses after the Oxford High School tragedy. In 2022, she made history as the first Black woman appointed to Oakland County's Health Officer position. By this point, Dr. Green was recognized as a leader whose work had a meaningful impact across the community. Charles Quincy Green Sr. had a very different story. He was 52 years old. Charles worked as a driver for Advanced Disposal, a waste management company. Charles had steady employment with the waste management company, working as a driver. Their daily work experiences were quite different. Charles had a more routine schedule, while Dr. Green's role involved conferences, public events, and crisis management responsibilities. Both Charles and Dr. Green graduated from Pontiac Northern High School, giving them a shared connection to the same community. According to Dr. Green's Facebook page, they got married on September 3rd, 2020. This was right in the middle of the pandemic, right when Dr. Green was taking on her most demanding role ever with the health department. During their marriage, Dr. Green maintained her incredibly busy schedule with pandemic response work. She was working around the clock, managing crisis after crisis, becoming the face of public health in Oakland County. Meanwhile, Charles continued his employment with the waste management company. The night before the tragedy, Dr. Green was at a Nightingale Award ceremony, this time supporting a coworker who was receiving the same honor she had won 2 years earlier. She was still showing up, still being the supportive, professional leader she had always been. May 11th, 2023 started like any other day. Dr. Green was expected at work. Her colleagues at the Oakland County Health Division knew her routine, knew her reliability. When she didn't show up, they immediately knew something was wrong. This woman had worked through a pandemic. She had managed crisis after crisis. She never just didn't show up. When Dr. Green's colleagues realized she wasn't coming to work that Thursday morning, they reached out to her family. Family members made the drive to her home in Pontiac, probably expecting to find her sick or dealing with some kind of emergency. What they found instead would devastate an entire community.
Parent murder-suicide in Pontiac has claimed the life of a barrier-breaking Oakland County leader. Good to have you with us for Local 4 News at 11. I'm Devin Skillian.
I'm Kimberly Gill. Dr. Calandra Green, who heads the county's health division, was found murdered in her Pontiac home this afternoon.
Investigators say it appears she was shot and killed by her husband, who then turned the gun on himself. Mara McDonald live at the county's health division, which I think is going to be closed tomorrow. Mara.
Devin, that's right. Both the North Health Clinic as well as the South Health Clinic in Southfield, they're closing them down to try and give her colleagues here a chance to try and regroup. And they're also bringing in counselors. When Dr. Green didn't show up at work today, the staff at the health division knew something was wrong, so they reached out to family.
Family members went to the home, started to walk into the house. It didn't look right. Smartly backed out, called 911. We immediately responded, made entry into the home, and found 2 individuals deceased.
Dr. Green and her husband, Charles. Sheriff's investigators say it appears to be a murder-suicide, but say autopsies and other crime scene data collection here will be critical.
It appears that our female is the victim and a male individual was the perpetrator. Again, that's still early.
Family members I spoke to off camera at the home are in shock and trying to process this. When I reached out to County Executive David Coulter's office tonight, they too are having a hard time processing the news, saying our hearts are shattered at the news of the passing of our colleague and esteemed health officer, Dr. Calandra Green. Words cannot express how devastating this news is to our Oakland County family. Calandra was a beloved member of our team and a light to all who had the privilege to know and love her.
Family members walking into what should have been a safe space, their loved one's home, immediately sensed something was terribly wrong. They had the presence of mind to back away and call for help, rather than entering a potentially dangerous scene. That quick thinking probably preserved important evidence and kept them safe. The Oakland County Sheriff's Office later described what happened next. Here's what Sheriff Michael Bouchard told the media. When Dr. Green didn't show up at work today, the staff at the health division knew something was wrong, so they reached out to the family. Family members went to the home, started to walk into the house, didn't look right, smartly backed out, called 911. We immediately responded, made entry into the home, and found 2 individuals deceased, Dr. Green and her husband, Charles. Sheriff Bouchard continued. Sheriff's investigators say it appears to be a murder-suicide, but say autopsies and other crime scene data collection here will be critical. It appears that the female is the victim and a male individual was the perpetrator. Again, that's still early. The medical examiner confirmed the initial findings. Dr. Calandra Green died from fatal injuries and her death was ruled a homicide. Charles also lost his life that day, with the medical examiner determining the circumstances of both deaths. A handgun was recovered at the scene. Now, I know everyone wants to understand how this happened, what led to this moment, but the truth is that authorities have not released detailed information about any specific motive. The sheriff's office has been careful to say that no information about previous disputes or underlying issues between the couple has been made public. Dr. Green was a beloved public figure, a leader who had guided the community through some of its most challenging moments.
At Oakland County Health Department. And as it turns out, as you said, investigators determined that she'd been shot in the back and that she'd been shot by her husband who shared the home with her, and he had shot himself, both of them deceased. So 3 days later, I should say, on Mother's Day, family and friends gathered to honor Calandra, who everyone says was the most amazing, kind-hearted, awesome person. And even if you didn't know her, I think it's very evident when you look at the photographs of her that this woman was someone who had a large heart and a large personality and who welcomed everybody into her life. And it was very evident listening to what everyone was saying today. And I want to play some parts of the vigil for you. First, you're going to hear from her daughter, and then you're going to hear from her sister. Take a listen.
These past 4 days have been so hard. I couldn't sleep. I couldn't eat. You were everything to me. I love you so much. I am staying strong and staying brave for you because I know you will want that.
Y'all don't even know how much this means to our family. Y'all don't know. I didn't know how my sister affected everybody. There were people crying in the beauty shop, people crying at the eyebrow shop. I didn't know that. I knew she was mine because she was my best friend too.
The most heartbreaking response came from Dr. Green's daughter. She made a video message sitting on her mother's porch, unable to enter the house where her mother lost her life. Her words show us the devastating personal cost when domestic violence takes someone's life. Dr. Green's sister spoke about the loss as well. She said,
My sister was firm but fair. My sister was funny. She was kind. She was loving. She was the person that if you had a problem, you would go to.
She went on to describe how she didn't know until after her sister's death just how many lives Dr. Green had touched.
Y'all don't know. I didn't know how my sister affected everybody. There were people crying in the beauty shop, people crying at the eyebrow shop. I didn't know that. I knew she was mine because she was my best friend too.
The impact on her professional community was equally profound. A colleague who had worked with Dr. Green described the shock.
She was murdered, frankly, leaves me really angry, on top of the grief and the sadness and the shock that I feel.
2 clinics were closed Friday so staff could grieve. Coulter says no one saw this coming.
There was no indication that there was any issues at home.
Now the county is reflecting on all Calandra accomplished.
That during the pandemic, she really took the lead on standing up all of our COVID testing and vaccine sites.
She also organized mental health services for the Oxford community after the deadly school shooting and was passionate to making sure all of Oakland County got access to public health services. Her colleagues knew she had so much more to accomplish.
The possibilities based on her abilities were endless.
Let's be clear about something. Charles had steady work in a field that literally keeps our cities running. Waste management jobs provide good wages and benefits in most areas. The conversation about job status distracts from understanding what actually happened here. Here's what's important to understand. We don't have verified information about what was happening in their relationship. Domestic violence is complex, and the real factors behind these tragedies often aren't what people assume. Dr. Green's case shows us that domestic violence doesn't discriminate based on education, income, or professional status. The colleague who saves lives during a pandemic can still need saving herself. We need to check on each other, regardless of how successful someone appears to be. The investigation into Dr. Green's death was handled by the Oakland County Sheriff's Office, working with the Medical Examiner's Office and other agencies. Because of the nature of the case, a murder with both lives lost in the incident, there would be no arrest, no trial, no opportunity for the legal system to provide answers about exactly what happened or why. This is one of the most difficult aspects of these cases for families and communities to accept. With no surviving perpetrator, so many questions remain unanswered. There's no opportunity for accountability through the legal system, no chance to understand the full scope of what led to the violence. The families affected by domestic violence cases like this often feel a unique kind of grief. Dr. Green's family lost not just a beloved daughter, sister, and mother, but also someone who is making a tangible difference in thousands of lives. The ripple effect of her loss extends far beyond her personal relationships. The questions raised by her death remain relevant. How do we support people who appear successful but might be struggling privately? How do we create environments where victims feel safe asking for help? How do we move beyond surface-level discussions about relationships to address the real dynamics of power and control that drive domestic violence? Dr. Calandra Green dedicated her life to protecting community health. Her death serves as a reminder of domestic violence's devastating impact and the importance of supporting those who might be struggling, regardless of their apparent success. The investigation into her case may be closed, but Dr. Green's story raises important questions about domestic violence, professional success, and how well we really know the people in our communities. Her story reminds us that behind every domestic violence statistic is a real person with real contributions to make to the world. When we lose someone to domestic violence, we lose not just their life, but everything they might have accomplished, everyone they might have helped, and all the ways they might have made the world better. Dr. Calandra Green's life mattered. Her work mattered. Her death was a tragedy that extends far beyond one family, one community, or one profession. It represents a loss that we're all still trying to understand and learn from. I hope these stories help you recognize warning signs and encourage you to seek help or offer support before it's too late. I'll see you in the next episode of Crime of Passion. Thank you for watching.